Hi, my name is Elaine, and this summer I worked on my project, the localization of epileptic zones in focal epilepsy patients using amplitude of low-frequency fluctuations. To begin, what is epilepsy? Well, epilepsy is one of the most common neurological disorders that causes recurrent seizures. Seizures are sudden, uncontrolled bursts of electrical activity that may result in involuntary behaviors. Focal epilepsy is a type of epilepsy that is characterized by seizures originating in a specific region of the brain, and it makes up around 60% of all cases. Unfortunately, 1/3 of epilepsy patients remain drug-resistant, experiencing persistent seizures despite using various medications. For these patients, surgery is the best option in hopes of achieving seizure freedom. However, accurate localization of the epileptic brain areas to be removed is required prior to surgery. During pre-surgical evaluation, we specifically try to define the seizure onset zone, the brain area responsible for seizure generation. We look for areas with interictal epileptiform discharges and high-frequency oscillations, which are two biomarkers of the SOZ. The current gold standard for identifying the SOZ is intracranial electroencephalography. This method is highly invasive because it involves the implantation of depth electrodes into the brain to record electrical activity. It also has very limited spatial coverage. The depth electrodes can only record epileptic activity from the area adjacent to the contacts. This means that it is more likely to incorrectly define the SOZ if seizures originate in areas not covered by the electrodes. So can we use functional magnetic resonance imaging instead? fMRI is an imaging technique that detects blood flow across the entire brain, which is an indicator of activity. It's non-invasive and has much greater spatial coverage. However, on its own, fMRI is not useful in accurately localizing the SOZ because it requires the patient to have a seizure while in the fMRI machine, which we cannot control. Instead, we are interested in resting state fMRI, which scans patients while they are at rest. Current literature reveals that by simultaneously using IEEG and fMRI, we can accurately localize the SOZ due to the combined method having high spatial and temporal resolution. However, we have yet to confirm the use of resting state fMRI alone in accurately localizing the seizure onset zone. An analysis method of resting state fMRI, called amplitude of low-frequency fluctuations, measures total brain activity at low frequencies, which is relevant in identifying abnormal brain activity associated with epilepsy. Fractional ALFF gives us more specific information. Thus, this project aims to evaluate the use of ALFF and FALFF, two parameters of resting state fMRI, in accurately localizing epileptic brain areas in focal epilepsy patients. To do this, pre-existing data from 44 focal epilepsy patients that underwent simultaneous IEEG fMRI were acquired. Data included the identified epileptic brain areas, so the SOZs, IEDs, and HFOs, and the associated electrodes from the IEEG recordings. In collaboration with two undergraduate peers, electrode coordinates for each patient were manually recorded. Then a MATLAB script was used to process the data to generate the ALFF and FALFF values. Finally, I conducted statistical analyses, which involved t-tests at the individual and group level to compare ALFF and FALFF values between epileptic and non-epileptic brain areas. Group results show that FALFF values are significantly lower in HFO zones and close to significantly lower in both SOZ and IED zones. Overall, FALFF values being lower in epileptic zones indicates decreased brain activity and is likely a sign of pathology. Variability of ALFF also shows a significant difference between SOZ and the non-SOZ, indicating that ALFF values are consistently lower in epileptic regions, whereas for healthy regions, ALFF values are more variable. Thus, our conclusion is that although variability in ALFF may show significant differences, fractional ALFF is a more promising feature that could accurately localize epileptic brain areas. We should continue evaluating the use of other resting state fMRI analysis methods, such as regional homogeneity and functional connectivity, in accurately localizing epileptic brain areas. My colleagues are continuing to evaluate them in addition to ALFF in aim of developing the use of resting state fMRI as a standard method in pre-surgical evaluation of drug-resistant focal epilepsy patients. I would like to thank Dr. Pierre Levan and Hadi Narimani for supervising this project. I would also like to thank the Hotchkiss Brain Institute for funding this project. Here are my references.